New Zealand is delaying reopening plans to the end of February over Omicron concerns. International border restrictions were set to progressively loosen from next month, starting with New Zealanders in Australia.
Cabinet has decided to push back the date for self-isolation for those travelling from Australia from the 17th of January to the end of February so that we can accelerate the rollout of that booster program and have as many people boosted with their vaccination before we have people isolating at home across the international border.
Authorities say the move is a precaution while the severity of Omicron remains unclear. The time will be used to boost protection and slow the spread of the new variant. The government has announced a raft of measures. They include shortening the booster shot interval to 4 months from 6. A self-isolation option for all international travels is scrapped, and the length of stay in a state quarantine facility will also be increased to 10 days from a week. For more on the fast-spreading Omicron variant, Professor Tikki Pang, visiting professor at Yong School of Medicine from the National University of Singapore, joins us live now. He's also co-chair of the Asia-Pacific Immunization Coalition at NUS. Professor Pang, there is this push to coexist with COVID-19, depending on which country you're in, and to move to this endemic status. What needs to be done for us to finally put the challenges of COVID-19 behind us?
I think there are 3 key, strategies that need to be in place. Firstly is to continue to push for vaccine coverage, including booster doses. Secondly is to maintain your capacity for monitoring and surveillance, including genomic sequencing, to detect Omicron and other variants that may appear in the future. And thirdly, perhaps very importantly, is to make sure that your healthcare system is prepared to deal, should Omicron prove to be able to cause more severe disease. So this is about hospital capacity. It's also about protecting your frontline healthcare workers. So those are the 3 key issues, I believe.
Professor Pang, let's take on the first issue, which is vaccination. Now, if we were worried during Delta or prior to that about the vaccine divide, countries that have vaccines, countries that don't have vaccines, Omicron is bringing that even more to the fore because early studies showing that some kinds of vaccines are more or less effective against Omicron. And of course, now the urgency to get the 3rd booster dose because there, again, early studies suggesting that 2 doses, the full course, may not be enough past 6 months to fend off Omicron. So vaccination, that has become a greater challenge now with Omicron, or would you not agree with that?
No, it's obviously a bit of a challenge because Omicron has so many mutations. It is probably likely that it would escape some of the vaccines. But I think what you need to remember is that, yes, it may be, some of these vaccines may be less effective, but it is still very likely that those vaccines will prevent severe disease and hospitalization. And also remember that the technology exists that if the vaccines need to be adjusted in the future because of Omicron, that can be done quite quickly. So my position is still the same. Continue with maintaining maximum vaccine coverage.
Professor Pang, you also mentioned the fact that we need to protect our healthcare systems, and this is something that we have been attempting to do from the beginning of this pandemic, but Delta has challenged our response to that. What about Omicron? It's proving to do the same.
Yes, but Dawn, as has been mentioned by WHO, by many people, it's actually not really strong evidence that Omicron is going to cause more severe disease, which obviously has implications for the health system. The evidence is good that it's increased transmissibility even higher than Delta. What that means is as more people get infected, obviously there are going to be more people with perhaps more severe disease, especially those who are unvaccinated, especially those older, those with underlying morbidities and conditions. So, continued vigilance. Your healthcare system, in addition to protecting your healthcare workers, has to be prepared with oxygen, with medicines, with ventilators, etc., etc. But the thrust should still be continue vaccination.
Professor Pang, I'll bring this up because the WHO says we want 2022 to be the year we put an end to this pandemic. And then you bring up these three pillars by which we judge whether or not we put an end to the pandemic. So, for example, if we could look again to your three strategies, how each one would, where would each one need to be for us to say we have now reached successfully, comfortably an endemic stage? So, for example, what would the capacity be? What would our vaccination level be? What sort of vaccines would we need? Look ahead to 2022 and tell us where you think we should be, say, for example, for Singapore to say we have put the pandemic behind us.
I don't think, the word, it depends what you mean by ending the pandemic. I don't think this pandemic is really going to end. Okay, as you said yourself, we need to learn to live with the virus. So once again, if you ask me what kind of coverage is good to maintain that, to learn to live with it, obviously as high as possible. Singapore's done very well. Europe close to 90%. But there are countries in the world, even in Eastern Europe, for example, where the vaccine coverage is only around 30%. In France, even in Switzerland, where I am right now, it's only about 66%, let alone sub-Saharan African countries. Okay, so as long as there are pockets of unvaccinated people anywhere in the world, the virus is going to continue being transmitted, and it's obviously going to lead to maybe more variants in the future. That leads to my second point. You need to have that capacity for monitoring and surveillance, especially genomic sequencing. And the third option, if suddenly it becomes more severe in terms of causing disease, your health system has to be prepared. So they're all interconnected, if you like.
Oh, thanks so much for all that. Professor Tikki Pang, visiting professor, Yong School of Medicine from the National University of Singapore.